Hi, Carol. Um,
Hi.
how are you?
I'm good, thanks. How are
That's
you?
good. I'm great.
Good.
So, just a introduction. Carol is one of my patients who's kindly agreed to have this conversation with me to share her healing journey and what she's experienced after having one of her severely infected teeth treated and removed. And she was in to see me a little bit afterwards for some more treatment. And what she told me was just so profound that I asked her to share it with me so I could record it and share the story with other people. And she graciously agreed. And so here she is. So,
Here I am.
so Carol, can you please just describe for me what you were experiencing before you had your tooth treated
Right.
and some of the symptoms, and then we can go from there.
Okay, so unfortunately, I don't remember how long ago I got this root canal, but it was many years ago, and it has never felt right, if there's such a thing.
Yeah.
So, but I went about and there was no pain. It was just like, okay, so I've got this root canal. And then I had had many dental visits where I said, it just doesn't feel right. And then there's x rays and it's fine. And then the years went on, like decades. And then I saw a doctor because I had what I called my rope. And so coming from my neck all the way through the breast, down my abdomen, and then ending at my lowest, I think they're called false ribs at the side, was a rope. And if I pulled on my skin, you could actually see like there was a rope under my skin. And so, people would palpate it and go, oh, that's weird. But nobody had a, an idea for what it was. Then the rope disappeared, and then the pain stayed in the ribs. And then, life goes on, and years went by. The rope came back, and then the rope disappeared. And then recently, so last year, it came back and it was intense. It was quite tight. And then the thing that really lit a fire under me to get this tooth removed. In the meantime, I'd been doing lots of research about root canals and what can happen. And then a friend of mine had a root canal that went south. And then I'm like, I think it's this tooth. So I'd actually had thermography done, the dental thermography, which revealed nothing. And I'm like, I still think it's the tooth. And then it was one day when I got out of the shower and I was bent over to put my hair in a towel, and that rope pulled a major dent through the breast. It was like pulled in like this. And so that scared me. And then that resolved, and I'm like, okay, good. But I knew it had to be the tooth. So then I saw another dentist, and he's like, oh yeah, well, I could send you to a specialist and they can fix that root canal. And I'm like, no, I just want it gone. And then luckily I met you virtually, and I just decided to do it. So I just decided I've got to take care of this. So you removed it. It's quite traumatic, the whole procedure, but you also did the cavitation,
Yeah.
and then the healing began. So I'm convinced that even on the drive home, I felt the lower ribs starting to heal and the tightness through my neck. So the start of the rope and the end of the rope, it felt like it was dissipating. So then I guess it's been almost 2 months now,
Yeah. I
and
think almost three.
almost three.
Yeah.
So I felt all like these lymph nodes were always inflamed as well. Not, I shouldn't say always, come and go along with the rope.
And that's what you told me that day, was that you had kind of a tenderness on
Yeah.
your right side.
Oh, it's the whole pathway.
Yeah.
The whole thing was tender, and my ribs were always sore. This was always sore. There was a lump in the breast, and I'm like, oh. So But with thermography, dental, and breast, nothing was ever revealed. But I knew there was something going
Yeah.
on. You could see it and I could feel it.
Yeah.
So then as the healing progressed, the lymph nodes went down. But then, as I was telling you, I was sick,
Right.
detoxing something. I was healing, and it was like a crazy cold with a cough. And then I got better from that. Excuse me. And then again, a couple weeks later, sick again. And then finally, as you know, the stitches come out and the healing is further along and, you know, you can eat better. Then it was like, oh my goodness, this is gone. Like the upper part, that rope, I can't feel it anymore. My lower ribs, there's no tenderness anymore, even though I really try to find it. And then it was like it was shrinking from the other ends, from each end. And then the lump and the tenderness in the breast, that's gone. And I would say there might be a little tiny spot if I go looking for it. But before I would always feel it. It was constant. And then yeah, I'm super pumped. And then as this disappeared, so I was getting like I'm not as young as I used to be. And so I didn't know if I wasn't eating right or exercising enough. But often, like when I would bend my wrist and my fingers, it was like puffy, as if I had gained weight around there. And I knew it was inflammation of some sort. Of course, when you bend your wrist, there's a wrinkle, but these were like puffy lumps and they're
For a
gone.
long time, like for a
Oh,
long
yeah, that
time.
was going on for probably a year. But again, it would ebb and flow,
Yeah.
but definitely more often than not. And so I haven't radically changed what I eat and drink, but this was the one thing that I did that was radical.
Right.
And I haven't had that puffiness since.
In both hands.
Both
Like,
hands.
yeah.
Yeah. That was,
And you told me that like your body let go of like 5 pounds
yeah,
worth of fluid or something,
yeah,
right? Like,
yeah. There was 5 pounds that I lost over that time. And it wasn't all just because I couldn't eat, because it's still gone. And I was having
right,
smoothies and soups and stuff. It's not like I was in a major calorie deficit.
right.
But yeah, I would say 5 pounds of fluid has been released.
Amazing. And
Yeah.
did you have like before the treatment, did you feel lousy too? Like did you have energy depletion or were you kind of functioning well?
I was functioning okay. I had a lot of stress in my life, so it's hard to know if it was the stress or the tooth.
Yeah.
Yeah.
And and then I asked you the other day, but I'll ask you again, and how are you feeling now?
Oh, I feel great.
Yeah,
Yeah.
you're gardening all the time and
Yeah. I'm out
running your
there 5, 6
business and
hours. Yeah.
awesome.
I work all day, garden all night. No. But no, I feel great. I'm so glad to get this done. Like I've been putting it off for far too long, but it was also because there was nobody saying, this is what you need to do. Like, you really need this out. Everyone's like, oh, we can save it. We can do this. And it
Right.
was, it, and it's not all on the professional. So finally I said, okay, I want it gone. It needs to be gone.
Right.
And I had talked to enough people that I thought, no, this has to be done.
Yeah. There's a different focus of focusing in on just the tooth problem and wanting to like we're trained as dentists to do what we can to save people's teeth,
Hmm.
and that takes priority over the overall health of the human that we're working with.
Yeah. And
And
I had told more than one doctor, both medical doctors and dental, that I've got this thing
right,
going on. And yeah, it was not because they're so busy, right? And so he's like,
Yes.
do this or try this, or go for thermography, go for this, have another x-ray. And I'm like, no. And so then I finally just dug into the research and decided that this has to go.
Awesome. And the other thing I want to point out is you you cover all the bases with your lifestyle and your nutrition, and that's also why you had such a positive experience healing.
Hmm.
And I for whoever's watching this, I just want to really hammer home that point that as the clinician, we can do everything within our power to do the best surgery and have the best outcome, but we only spend 3 or 4 hours with you, the patient, and then it's up to you. What are you doing for those next 1,000 hours that your
Hmm.
body's going to be healing? And also, what did you do leading up to it to prepare your body for the surgery? And
Right.
that's crucial. And you Carol, like, you didn't you live an extremely healthy life, and I've mentioned to you when I'm with you that you're very healthy, and so that's more than 50% of the reason why you've had such a successful experience over the last few months in getting better and healing.
Right.
So yeah, well done.
Thank you.
and and
Likewise.
oh, my pleasure. Is there anything else you want to say?
No, I just think that I think there are a lot of people now that are willing to take responsibility. I think that the time of a pill for every ill
Yeah,
is fading away. And
yeah,
so I think there are more and more patients that are willing to do what it takes to help themselves heal.
right. It's the only way, right? Yeah,
It really is.
yeah. Amazing.
Thank you.
Well, I'm incredibly grateful for you and having met you, and for doing this with me now. And we want to help more people along their healing journey. And
Hmm.
so I just want to say thank you from the bottom of my heart. And
Well, thank you for getting the knowledge. Like you're the guy.
I'm
You're the guy with the
yeah,
knowledge and the
it's a work in
skills,
progress, but it's yeah, it's I know we're on the right path. So
right?
yeah, thanks for sitting down with me, and I hope you have a wonderful evening.
You too.